How was your week? I know that nobody's going to open their microphone and tell me how their week has gone. Today is already Wednesday, and today is Wellness Wednesday. And for those of you joining for the first time, but I know that most of the faces I've seen are familiar, family members. We normally talk on Wednesdays. We try to pay attention to our health, pay attention to our body, because our body is our greatest asset. If your body is not working well, you can't make it. Nothing else works well. Um, so it says this meeting is being live streamed. Okay, fine. I've noticed that. So the whole idea of this Wellness Wednesday, which we come together every Wednesday, is just to discuss about us, our health, our greatest asset, which is our body. One of the biggest things that I've noticed is that there are so many things that we did not know that contribute positively or negatively to our health and overall well-being. And we've made those mistakes. We didn't know. For example, last week, we talked about what happens to your body, what happens when you eat at night and then you lie down. When should you eat? What happens? And we found out that majority of us, we've had a lifelong habit of destroying our health based on when we eat and then go to bed. And we did not even know the magnitude of damage. Yes, something will tell you that, yes, it's not good to eat and maybe go to bed, but what's the magnitude of damage? And I was so excited about last week's class. I had a lot of phone calls after. It was an exciting class, and I believe in my heart of heart that after that lecture, even if you eat late, you know what is happening to your body. But I'm sure a lot of people will no longer eat late to promote health. So that's that. So that being said, welcome to today's class. Today's class is gonna be short. I'm not an expert directly on eye. I have to be very clear on that. However, I found out in our clinic that there are certain things we do for people that have either glaucoma, dry eye, wet eye, macular degeneration. So for some reason, their eyes just improve. So I thought maybe I should share it with my family. You people are my family, so that you can actually, you know, do these things and be proactive, um, and in keeping a very good and healthy eye. Um, I've always talked about my mother on this platform, and she's one person that when her diabetes in those days got so bad and she was on so many medication, she could hardly read, her eyes were going. And to God be the glory, after we started this lifestyle modification thing, and the things that I teach in this class, I want to tell you that today, my own mom, she's almost 90, she reads her Bible without glasses. This is somebody that was knocking on the door of blindness. So for me, I know that in black and white, if you do something about your eyes will serve you longer. Two, why are we talking about the eyes? We are here because we would love to live long. Long means, whenever God gives us is long, but we want to go with our eyes seeing well. But truth be told, unavoidably, just like in a man, the prostate gland will at some point enlarge, or in many people's lives, at some point, the BP will go up, sugar will go up. The eye, the eye will progressively go down. It will eventually go. So that's why lots of old people, they can't see very well. So today we are going to know why they cannot see very well. But we also thank God that we have what it takes to make sure that we see very well even to the last day. So that is what we are going to discuss on today's lecture. So when I saw my own mother's eyes improve, I think like now that she's almost 90, she's talking about having some minor cataract here and there or whatever. I said, Mommy, we'll check it out. But the truth is that she was knocking on the eyes of blindness some 20 years ago, but today she can read without glasses. She reads her books, her Bible, anything she wants to read, she's reading without glasses. All right. So that's one. Then the second story I want to share is about somebody that we know very well in the house. And his story goes like this. So he was sitting one day in his living room and he says, somebody should go and take is it electric circuit, circuit breaker? Somebody, oh God. Somebody should go and check it because he was sitting there and all of a sudden everything went black. So there's something called retinal detachment whereby you can just be sitting here progressively, the retina will just detach and you can go blind. Mostly it happens for diabetics. And I want to tell you that it can also be totally prevented and avoided. So many things that affect the eyes can be prevented. By the time you're done with this lecture, at least something will definitely change concerning your eyes immediately and also later. So I'm going to quickly jump into the presentation. I'm going to try to keep the presentation as short as possible. I mentioned earlier, I am not an optometrist or ophthalmologist. I'm sure you know the difference. One of them is a medical doctor with specialization in eye surgery. So that's the one with ologist. Then the one with metrist is the one that can just be looking at your eye, change your glasses. They both know the eye very well, but the only difference is that one can do surgery. One is like a medical doctor with a concentration on eye, and one is not an eye technician because they know almost as much they know about the same thing, but one is just more deeper. One is first a medical doctor with a specialization in eye. So I need you people to have those terminologies out there so that if you go to check your eye, you can clearly ask the person to tell you the difference. Because in Nigeria here, just an eye technician when I worked for a regulatory agency, we used to see in patent medicine pharmacy, they do surgery, deliver babies, they give IV fluids in patent medicine pharmacy. So just be very careful with whoever you hand over your eyes to. So let me share the slide. It's a short presentation and then we walk away learning something. For those of you just joining for the first time, my name is Dr. Susanna. My background is in preventive and promotional medicine. I have a master's in preventive and promotional medicine, and I also did lifestyle medicine, the Harvard Medical School program on lifestyle medicine. So I am here to teach my passion, which is in preventive medicine, which says that you can do so many things and you will not be sick. Her whole objective is we want to have a sickness-free body. That is why we are here. We don't want to be sick. And if sickness comes, let it come for like mosquito bites, and then you're sick for like 2, 3 days and it gets out very fast. Your body should not be a sickness warehouse. Your body should not be a drug warehouse. And even if you're taking a medication, let it work. Not that you need another drug, another drug, another drug. So we're just doing our own part to contribute to our own health and well-being. Our eyes is what we are talking about today. So I think I'm sharing my screen now. So I'll just go there. All right. Well, take this as a general eye wellness class, because even though I picked macular degeneration because it's so common, and you at least have to hear that word from me so that if it ever sets in, which God will not allow, you can know what macular, this is the spelling, macular degeneration is all about. Okay. All right. So what is macular degeneration? Let's do it. So the objective is to tell you what macular degeneration is and how to not have it. So what is that? So as we get older, things start happening. And when you go to grandma in the village, they'll say, grandma is doing very well, but she's not seeing very well. And then you see grandma, she'll be keeping her eye like this, she'll put her head like this, she'll just try and she'll squint. Is because in the past, she used to see like this road. If you see this picture on my screen, she used to see this way, but now she's seeing like this. So there's this black spot hanging over the eye that whether she's bending up or down, if you see those people with macular degeneration, this is what they see. So this is the reality. On the left-hand side is how you're supposed to see. On the right-hand side is end-stage macular degeneration, which we are supposed to, and like if you live to be 200 years old and stuff, and the eyes go, this is where the eye will end up. But with lifestyle and everything, we can have our eyes intact and not end up with this type of condition. Why is this important to us? We are trying to live well and live long. So what are you living long and well if you cannot see? So that is why we must see. So as a way to introduce this, our eye is a delicate and vital organ that connects us to the world around us. Our eyes connects us to the world around us. I want to share something. I think maybe you have seen it before. There was an old blind man sitting on the street, and he had a signboard in front of him. And the signboard says, I am hungry. Please give me pennies or dollars. I am hungry. Please give me pennies or dollars. So people would just pass, and nobody gave him anything. And then somebody came and walked past and just went back, carried the signboard, turned the other way around, and wrote, "The world is such a beautiful place, only that I have no eyes to see it. Have a beautiful day. Help if you can." Let me tell you, the man could build a house in one day. So why am I saying that? Blindness robs off of, you don't want your eyes to go. Trust me, value what you have. Okay, so this macular degeneration, it starts happening around the age of 40 and above. It will start. It's an unfortunate situation, but it will eventually come.
Musa.
So let's use the picture. Please mute yourself. So this is your eye. Okay. Okay, let me. Okay, I have to mute the people since the person will not mute herself. Hang on one second. Let me mute. Where is this one for mute? Okay. Oh my God. Okay, I have done it. So this is how your eyes are, okay? So let me use this picture. I like this one better. So this is your eye, okay? This is your eyeball. You see that spot there? It's called the macula. What is macula? Really, to oversimplify, is the part of the eye that controls things like how sharp the color is. So if you used to understand sharp color red, and all of a sudden all the colors are a little bit dull, there's a chance that macular degeneration has already set in. Straight line, like straightness of a line, is controlled by the macular. So let me just pick two that you can remember: straightness of line, sharpness of color, and fuzziness. This is the macula. What is under the macula there? That thing sticking out is the optic nerve. That optic nerve is the one that is mostly affected when people have glaucoma. But this one, we just want to focus on macular degeneration, because everybody will have some kind of macular degeneration with age. The question is, what will be the magnitude? Like how much macular regeneration will you have? Okay. So this is the normal macula, how it is when it's wet or dry. So there are two types of macular degeneration. The dry one, which is 80 to 90% of people with macular degeneration, is usually the dry one. And then the wet one also happens with 10%, but it's more deadly than the dry macular degeneration. Here's another picture. This is your eye. The macula is there. And then this is the wet and the dry again. I think this picture is also good. So this is dry macular degeneration, wet macular regeneration, etc. Now, if you look at this particular picture, you can see, just like I showed you, where the macula is. This one is the optic disc, which, if we're talking about glaucoma, we'll be visiting that one very well. And then let me see, where's the retina? Because this is all about the yes. But anyway, like I said, we are not here to do anatomy of the eye or even get too technical. But let me go to the part that concerns us and what we need to do today briefly. This world is so beautiful. Sometimes we just need to go out and be part of it. And we need our eyes, okay? So macular degeneration, commonly called age-related macular degeneration, so it happens with age, is a progressive, it doesn't happen overnight, progressive degenerative disease. Just like we talk about spondylosis, like the spinal cord, there's this progressive degenerative disc disease and all of that. It also happens for the eye, and it affects the macula, which is the small central portion of the retina responsible for that is sharpness, and then sharp central vision. Okay, so the macula enables tasks like reading, okay? So driving, recognizing face, seeing fine lines. So in macular degeneration, the photoreceptor cell in the macula gradually deteriorates, leading to blurry vision, distorted vision, dark central vision, and etc. So that's what usually happens. We know the retina is the light-sensitive tissue at the back of the eye that captures image and sends them to the brain, while the macula is a 5 mm area at the center of the retina containing dense photoreceptor cells for colors and detailed vision. I just want you to know that. So anything color, straightness, and everything is your macula, because when it comes, you start drinking what I'm about to tell you, and by God's grace, it will help out. So I've already said we have two types, the dry and the wet. Okay, so how do you know if you have macular degeneration or you're starting to have it? Number one is if you're above the age of 40, there's a chance that it has already set in. If you're not above the age of 40, you can start preventing it. Okay. Two, I know that it's not listed, that's why I started there. Blurred fuzzy vision. I'll teach you a small exercise And I want you people to do this experiment with me, and you can see that you can so much improve your eyes instantly if you know how to do the eye exercise. And we are going to do it shortly. You're going to bring either, please get ready, either pick a piece of paper, maybe maybe something you cannot see very, very clearly from a distance. Just pick a spot. Then I'm going to give you that eye exercise. You do it, and then you go back and look at that, and you see that you may be able to see that thing clearly. So you look at that thing, you'll not be able to, we'll do it before and after, just now, to show you that you can actually alter deliberately the health of your eyes if you want to. Another symptom of macular degeneration is dark blank spot in the center. I will show you the picture of it. Straight line appearing wavy, okay? Reduced color brightness. So, like I always say, sharp, bright red color. All of a sudden, all the colors you won't even know that all the colors are now dull, but you just feel like the world is dull and boring. So that is why it is mandatory. You go, what if you're not wearing glasses? Maybe after the age 20, 30, 40, just go and see a doctor, and you'll be like, I didn't know that something can be this bright. You start enjoying your better vision, and but we don't want, is this not a lecture about glasses? It's a lecture about true eye health. But I just picked on macular degeneration because it's a must for everybody except you deliberately avoid it. Difficulty recognizing faces, etc. If you're already experiencing blurred vision, fuzzy central vision, stuff like that, then your macular degeneration might be real already. So this is it. I'll show you one last example. Look at this one. So this is a healthy macula, just like that. See the dry one, and then see the wet one. Okay. Now look at this. So when you are at risk, you see this boy on the picture. When it is starting, it's like this. Then early stage, things are fuzzy. Remember, and then intermediate. Believe me, it gets to this advanced stage with age. Okay. But a lot of people just end up at early and intermediate stage, and they may not even know they have it. So sometimes you just, because your body will just adjust that is how the world is. But the world is not like that. So here are some risk factors. Age, especially after the age of 50, it has already set in some form. It might just be less than 1%. But from age 40, people are starting to experience it already. If you have a family history, then if you're like this kind of maybe albino or somebody with very light pigmentation of the eye, then easily you can have more of macular degeneration. Modifiable risk factors, you can see if you smoke, you dry up your this thing, you get the dry one very fast. Poor diet, we'll discuss that. Medical condition like high blood pressure and high cholesterol will will increase your chances of having macular degeneration. For glaucoma, I think it's even diabetes that is higher for that one. But for this macular degeneration, obesity, get your weight in place. Because we used to say, oh, weight, it will cause a stroke, to cause this. You can imagine that obesity is now going to cause your eye, inactivity, etc. So I'm going to take 1 minute, even though I don't have a slide, to talk about excessive sun exposure. Sun damages the eyes. It damages it so badly. It's just that the eye has a way of correcting itself. So if you're not wearing glasses that changes into very dark colors when you're under the sun, you just have to, for my sake, because I want you people I want to see me when I'm 100, and I want to see when I'm 100. Okay, it's God that gives life, so that is by the grace of God, it's whatever God wants. But the point is, if you start wearing UV ray protective sunglasses, they have a lot of sunglasses that they're selling on traffic. You can buy like Ray-Bans. You have to invest in your eye. Even if you don't want to wear prescription glasses, you can actually go to a proper eye this thing and say, I want the highest protection for my eye. Those people that have had eye surgery, etc., they will give them one glasses that block the sun from every angle, and they start wearing it because they now see that it's after you've done eye surgery, then you know the meaning of sunglasses. We that we've not done surgery, we don't know the meaning of it. So children should start wearing sunglasses. Teenagers should start wearing sunglasses. Definitely, it's not Yanga anymore. It's not Gaiman. It's protection. So from now on, I'm going to be the sunglasses inspector general. So if I see you without sunglasses, wahala don't deal. So let all of us go get sunglasses. I like Ray-Bans. I'm not a distributor. It's just that they tell the truth. So if they say that it gives you certain amount of UV protection, it actually does. There are other companies that are doing better than Ray-Bans, but I feel that if your eye is an asset, and according to the definition, it's what connects you to the world. Oh my God, please do. So at this point, I want to share a very short story. There's a client of ours. She came to us. She was suffering from very obesity, and it destroyed her knees. So she had gone abroad to do surgery for her knees, and they told her that she's not fit for surgery. She needs to lose some weight and get her heart and act together. So she came to our facility. To God be the glory. We were able to reduce her weight. In fact, she even sent her children from UK. Everybody, she was so happy until she got that phone call from abroad that when is she coming for her surgery, which she had paid for. And she realized that she's fit to fly and fit for surgery. And she decided to go abroad for the surgery. Now, why am I telling you? It's because before she went abroad, she had paid for the father. And well, the unfortunate part of the story is that when she went abroad to go do the surgery, she actually died there doing the surgery. Doing the surgery, we don't. Nobody can tell because when you die abroad, is automatically forgiven when you die abroad because it's abroad. So we don't have the right to have questions and everything. But if you die in Nigeria, you know the meaning of it. Useless hospital, one doctor, this, that. Not all the times, but the point is, a lot of people that die abroad, I notice there's not too much questions because maybe they have earned that reputation that they did their very best and they don't kill people anyhow. But anyway, she died. So the dad, came to our facility, and he had about 80 something grandchildren. Most were in Abuja. So all of them came to see him and he couldn't see them. But to God be the glory, by the third week, because he stayed with us for about a month, by the third week, he could see everybody. And that was one of our biggest success stories. Why we know that if you start paying attention to correcting your eyes can actually be improved and corrected because she was able to see the grandchildren. She now asked to take a group picture and all of that. So I just remember that story. All right, so let's do it. So how do you care for the eye? Um, Look at this one. It says nutrition plays a preventive and therapeutic role in macular health. I'm talking about macular health because it's one of the most common thing that will take our eyes, okay? So the macula is rich in pigments called lutein and zeaxanthin. Can you repeat it? Lutein and zeaxanthin. Say it again. Don't cut your tongue. Go lutein and zeaxanthin. Why I'm saying you should repeat it is because we now make supplement, not Dr. Physic. In the pharmacy, there are some supplements that contain lutein and zeaxanthin and can actually help decrease and even eliminate macular degeneration because we have used it and we have seen the result. So it says the macula itself is rich with this lutein and zeaxanthin, which filters harmful blue light and protects the retinal cell from oxidative stress. So anything that protects something from oxidative stress is what? Is an antioxidant. Is an antioxidant. So we must not get our antioxidant from lutein, from supplement only. There are some foods that are very, very rich in lutein and zeaxanthin. So let's look at it. Number one is anytime you're eating, that's why I said just make, last week or so, I said just blend ugu, drain the water and just drink it. Anytime you're eating anything green leafy vegetable, whether it's ugu, spinach, kale, even eggs and maize, but green leafy vegetable contains loads of lutein and zeaxanthin. So, and the first medication for macular degeneration is actually that, okay? For general eye health, before somebody will ask me, is vitamin A. That's the one that we've been hearing. So that is why if you go and pick up a proper eye supplement, which even if you don't take it every day, even if it's Sunday medicine, except you're actually doing this, you can, if your eye is perfect, please do it from the natural food. But if you're already experiencing those symptoms that I'm discussing, you will greatly benefit from this. We have it in the Dr. Physic clinic, but you can also get it from any pharmacy. Remember, this platform is to teach what you can do by yourself from where you are. So if you enter any pharmacy, look at the label. Please, if you see any vitamin that contains lutein and zeaxanthin and is very cheap, it's just a label, don't buy it because these are not cheap antioxidants. So get the one that is a little bit pricey and protect your retina and all of that, okay? Another one is vitamin C protects your eyes. Of course, we know that vitamin C can be gotten from many food, but the food of choice for eye is guava. If it's guava season, it's really, really good for your eyes. Pawpaw, anytime you're eating pawpaw, know that you're doing something very big for your eyes. And then peppers, like we're talking about all these like green peppers, red peppers, and stuff, they contain loads of antioxidants that is good for the eye. Vitamin E is also good, prevents oxidative stress. We can get it from seeds like almonds. And then zinc is also good for retinal metabolism. You get it from beans, seafood. Look at this, sardine, mackerel, salmon, and flaxseed. I think every day, no day should pass if one of these things should not enter your mouth because number one, in Nigeria, is affordable. Not too affordable, mackerel, but mackerel is such a healthy fish. I don't know another name they call it in Nigeria, but I know it's mackerel fish. I don't know the other name. I don't know if mackerel has another name, but that mackerel fish, we should not play with it. Salmon is another big fish, but it's very, very expensive. And if you notice, one of the things you will know that improves eye health is omega-3, is because of this salmon and stuff like that. And finally, the one we used to know when we grew up was vitamin A, carotene. It supports vision in general and epithelial repair. So carrot, sweet potato, especially the purple and the reddish one is the one we are talking about, because the sweet potato that is white, which is very common, is still very good, but that orange color sweet potato, it's really, really powerful for the eyes. Let me talk about carrot. In Nigeria, we just either chew carrot or sprinkle it on rice or something. You can actually make carrot soup. I make sure I have carrot soup once a week. How do you do it? You just boil your carrot, you pour it inside the blender, you blend it, maybe add a little bit of coconut, a little of coconut water, and you just take it as this carrot soup. So carrot soup is very good for the eye. So anytime you're doing carrot, sweet potato, you can switch your sweet potato to the purple or the reddish one, and even palm oil in moderate use will actually improve your eyes. Okay, so these are some things that will improve your eyes. There's a very expensive medication that we use, clinically proven to decrease it. You can see that is a supplement. It contains vitamin C, E, zinc, copper, lutein, and zeaxanthin. So we've seen it work in our clinics, in our clinic setting. If you pick up a vitamin that contains it, it will really help to improve your eyes. Medical treatment, yeah, this one is a little bit technical. For lifestyle modification, smoking is the number one killer of eye, okay? Second killer of eye is just this sun. Which sun? Any sun after 12 o'clock is so damaging to the eye. In fact, it's just very damaging to the eye. So you can use, like if you go out on a morning walk and the sun is not too bright, you can manage. But I think all of us should start protecting. Me, as I'm talking here, I don't like glasses. That's why I don't wear it. So, but because I know that I need to protect my eyes, I wear it and it feels like I'm doing guy man. It's not guy man, it's your future. So let's wear it together. Colorful food too. Anytime you eat colorful, just know it's going straight to your eye because your eye loves color to start with. Any colorful food is going straight to your eye. When you exercise, it promotes blood flow to the eye, and then if you manage your chronic condition like your blood sugar, BP, and cholesterol, I already said those three things, they totally destroy your eye. So when you have like people that say, oh, my BP is not that high, so they didn't start to control it. Any day your BP is high, you have destroyed your eye that day. Any day your BP is not within range. So anyhow you have to do to get your BP within range. At least in our own community, we have Oxivite, which always helps to push the BP down. But find a way, add other things. Maybe we'll do another lecture on BP and some things that we can use to keep the BP down. But the BP must stay down. If not, you damage your eye. Sugar must stay down, you damage your eye. Cholesterol must stay down or you damage your eye. Go for eye examination and then we can go from there. So this is, I think, my last slide. So from a wellness standpoint, macular degeneration really reflects oxidative and inflammatory imbalance in the body. Okay, so it's actually from the body that it affects the eye. You can imagine. So maybe apart from the sunlight that can, add, everything else that happened to the macula is from the body. Can you imagine? So healing involves nourishing the body with whole food, antioxidant, whole food, managing stress through relaxation, staying physically active, and then practicing regular detox and eye relaxation technique. So I'm going to teach you some eye exercise right now, so that you can see that you can instantly improve your vision using that eye exercise. Anytime you drink green tea, if you come to Dr. Physic Clinic, there are only 3 teas that we really serve you for the most part, except we get fancy. We serve you green tea, we serve you moringa tea, we serve you hibiscus tea. Those of you that have come, you've tasted one of those teas. So because we know that from entering the place, something must enter your body. So you can also be a friend to green tea, moringa tea, and hibiscus tea for the sake of your eye. The green and moringa, the moringa acts like a multivitamin tea to the eye. The green tea is an antioxidant tea to the eye. The hibiscus, as you see, I told you, anything that is colorful like that, and then it's also a very powerful antioxidant to the eye. So there's something called eye relaxation. It's called 20-20-20 rule. We want what they call Vision 2020. So this is how it is done. Every 20 minutes, I will say anytime you remember, no matter what, if like you're looking at your screen now, look away about 20 feet away from where you're sitting for 20 seconds. So even in your office, when you're looking at a phone, don't allow 20 minutes to pass without you looking at a far distance deliberately to strengthen your eye. If not, you ruin your eye. So that is one. And then meditation and deep breathing exercise relaxes you overall. Before I show you the one that I said you can instantly see better, let's just conclude the lecture. Number one, this is Dr. Physic lifelong thingy, our clinically proven formula for a sickness-free body, which we teach every Wednesday. It's just a simple reminder that your body just needs a few things to work well. I want you to enjoy your body, like enjoy it. Like if you're supposed to have, your body should work when it needs to work. And these are small things that contribute to your body working well. Somebody shared with me this evening that when the person does not sleep well at night and wakes up maybe less than 4, 6, irritability, does not remember, and edgy and stuff like that, it's true, you have to rest properly. So the first medicine for us is rest as medicine. If you don't rest, you will be rested. I keep repeating it. So let us prioritize rest, because rest, another word for rest is what? Tissue repair, cell repair. If you're not repairing as you're tearing, you will not last. So pay attention to your energy level, your cellular energy, your systemic energy, environmental, even spiritual energy. There's something even called energy medicine, which one day maybe we'll do a small thing on energy medicine too. So for those of you who are just joining us for the first time, just keep coming. Today may not be your best of lecture. Tomorrow we might talk about hair. Another day we'll talk about the skin. Another day we'll talk about how to have the best quality sleep ever. We talk about things that happen, things that we don't normally pay attention to, that will help you live long and well. We jump to water as medicine. As we talk always, water transports nutrients. Water removes toxins from your body, because when those toxins gather, cancer will enter. Cancer is becoming too much. If it is not liver cancer, it's pancreatic cancer, it's breast cancer, it's colon cancer, it's ovarian cancer. What is it? Something just as ordinary as addiction to drinking your water on time. I'm not saying it will completely wipe it, but at least it will almost zero your chances of ever having cancer. So why won't we drink water medicinally? Look at ulcer. Why would anybody on earth have ulcer if you're drinking your water on time? You can't. Because you're going to aid digestion, you're going to wipe away the acid, you're going to even encourage better GI motility and all these things. So please drink your water. We advocate for 6 bottles before 6 p.m., 650 cl bottle before. But even if it's 4, you can do it very well. But drink that water whether you're thirsty or not. Because you know what? If you don't drink water on its own, you will join something inside that water and drink it. And it's called medicine. So do your water as medicine, or you do medicine with water. Now, for your nutrition, God has put so much medicine in raw food. One day should not pass that something raw did not enter your mouth. I am begging you. So, live food gives life, dead food gives death. I know that some of you have already perfected this, but I want to really, your body is thanking you, and me too, I'm thanking you. Because a lot of diseases that people will know, you will never know it. So, because God is really faithful. I think, is it in Islam or something, they say for every disease there's a cure or whatever. It's not only in Islam, I think really it's everywhere. But I know I've heard one of our Muslim clients say that, and that is in the Quran. So the point is that if God is that faithful, then why do we carry that raw food, destroy it before we eat the poison of it? We talked about olive oil. Anytime you put olive oil, you take it from medicine to poison, like that. So this incorporates some natural food, no processed food. Try to get your protein, etc. We've done a lecture on protein, we've done on fats, we've done on carbohydrates, we've done a lot of lectures. Go back to the YouTube and listen to especially the lecture on protein and see why everybody should not become a diabetic in this country. We are not having enough protein. We're supposed to have 1 gram per body weight. So if you're 85 kg, you should not have anything less than 85 grams of protein. And a lot of people don't even know what does 85 grams of protein look like. And lastly, I'm just jumping detoxification. So we have this acronym called REOWN: rest, energy, oxygen as medicine, water, nutrition, exercise. Exercise says move your body or you die. That is just the definition of you move or you go. I talk about a 4-5-year-old. They are always, if the 4-5-year-old was here, they will be all over the place like 10 times. But when you're older and closer to you sit in one place, and when you die, you're stiff. You don't move. So when you're moving, you're chasing away the spirit of death, because death is when you're lying down. So you need to move. Stand up, walk up and down. Detoxification. Wellness Wednesday is a day of detox. We do fasting from morning till evening, and maybe just drink only water or eat mostly fruits and vegetables, or do juice detox, something to keep our health. So in conclusion, macular degeneration is a preventable and manageable condition which, when approached early, while age plays a role, lifestyle and nutrition remains the most powerful tool to prevent it. Healthy habits, not just medications, are the foundation of lifelong vision wellness. So that's the end of the presentation. I'll just teach you that experiment for your eye, and then we can say good night. Okay, so bring a book or something. Get a book, look at some, maybe if you have a bottle of water in front of you, look at it very well as you're seeing it. So have you picked what you're looking at? Pick what you're looking at. Let me stop sharing my screen. Hello. Pick what you're looking at. So fix your eye there. Let me make sure that people are doing it. Fix your eye there. Pick anything. Madam, you're walking. Have you picked what you're looking at? Okay, maybe a clock, maybe a label, maybe something on your AC. Just pick what you're looking at and look at it very well. Are you seeing it? Okay. After notice how it is now, whether it is extremely you can spell out the word, just look at it. You see, because when you come back after this exercise, you're going to see it very, very clearly and you'll see what will happen. Okay, so now close your eyes. Close your eyes. Okay, take a deep breath in. Breathe out. So you're sending oxygen to your eye. Take another deep breath in. Breathe out. Okay. Now, you open your eye, but don't look at that item yet until we do what we want to do together. So don't look at that item yet, but just remember the item. Open your eyes small, then look up to the sky. Don't lift your head, just use your eye. Your eyes goes all the way up. Then your eye goes to the floor. Don't move your head, just use your eye. Then your eye sees the back of your right shoulder. Your eye sees the back of your left shoulder. Just rotate your eyeballs, okay? So once again, your eyes looking to the ceiling without shifting your head. It's looking to the floor without shifting your head. It's looking at the back of your other shoulder, looking at the back of your other shoulder. Then roll your eyes to the left, roll it. Roll your eyes to the right, roll it. Roll your eye to the left, roll it. Roll your eye to, then close your eyes again. Close your eyes. Take a deep breath in to your eye, breathe out. Now open your eye and look at the item you looked at before. If you did it well, it should be clearer and brighter. Did anybody notice that? Please, you can unmute your microphone and tell me if anybody noticed anything.
Yes, I noticed it's brighter from my end.
Amen.
Yes. It's brighter from your end, right?
Yes, from my end it's brighter.
Good. So if you form the habit of every 20 minutes, no matter whether you're on your phone, someone is asking question, what distance should be any distance, it's just to pick, even if it's a book you were reading in front of you, anything, you would have noticed that exercise, it strengthens your eyes instantly. So maybe in a meeting or wherever, I just want you to be armed with, we've learned breathing techniques on this class. This one is called eye exercise. So every 20 minutes or so, maybe you're on your phone, deliberately look away, very far distance, and count 20. Then roll your eyes, look up, look down, look to the back of your shoulder. Trust me, if you form this as a habit, and then you do your deep breathing, your eyes, in fact, is permanently preserved because it will just be sending blood flow and oxygen and it strengthens your eyes. So I've seen somebody who could not even see, everything was just together, did that with a little bit of tapping, actually, in you can add tapping. So if you tap, you can see way better. So that's that. So this is time for question and answer. Yes, ma.
Thank you so much, ma. My name is Arewa.
This is my first time of joining. Sorry, I don't have light. That's why the background is dark. Trust
It's
us
okay.
here.
We are in our country and we love it. No
No, it's
wahala.
the best country. Yeah. So, if one wants to approach your clinic, how do one get there?
Okay, so
And
if you
then
just text me directly, I'll send you the link and depends on where you're calling from also. So just
I'm in Ogun State. I'm in Ogun State.
okay, perfect. So we are all over the place in Lagos too. So just text me directly on however you join this platform. I would like to see somebody in your clinic, then I will go ahead and hook you
Okay.
up.
I
Yes.
should text you directly.
Ah?
You said I should text you directly.
Yes, you can text me directly, or you can just maybe drop your phone number on the chat. I'll screenshot it and send it to the appropriate, and then we'll take it from there.
Okay. Then secondly,
Yes, ma'am.
I have cataract in my eyes. And I'm approaching 70, but I've got cataract somehow in the
Oh, but you
eyes.
sound so young.
What did you say?
I say you
Okay, I
sound
sound.
so young.
I'm sure it's the grace of the Lord Jesus Christ who has been
It
so
is.
kind.
It
Yeah.
is.
And I don't want to do operation, honestly. Though people have been pressured, I told them I'm not interested in operation. I still believe that there are natural remedies, and I actually have supplement, but I'm sure by the time I come to your clinic, because no amount is too much to invest in one's eye.
Oh,
Because the
that's
Yoruba person will say Ojuloba. You understand?
yes, ma'am.
Yeah. So it's
Yes.
very, very,
Okay.
important. Then a friend of mine, let me ask this question, sorry, if I'm not taking. This reddish potato you talked about. She
Yes.
said they put it inside the water and left it, they diced it into the water
Yes.
and they put it in a bottle or so, left it for
Yes.
24 hours, and that they're
Mm-hmm.
using it as like an eye drop, and that the
Yes.
thing is really working for them. Is it ideal?
Yes, ma. The reason why I'm gonna say yes is because I have seen people that have used it and it works. You see, all the artificial medicine it started from natural medicine. Then we now take it. A lot of people don't know. I have a very strong pharmacy background. I have a doctor of pharmacy degree as well.
Yeah,
It's
I saw
even
your.
something like ibuprofen, this NSAID. Simple plant like it's a willow bark type of plant where if you take it raw, you get your pain relieved and every single thing. That is what they use to make this drug. So yes, I've seen people soak that, use it as a drop, fermented water of sweet
The red
potato.
potato.
Yes, but another way is also to eat it.
Okay.
So if you have a full-time job of incorporating it, I have someone who replaced everything carbohydrate with that type of potato, and to God be the glory. The person is even in the United States now. Takes the Nigerian version of it abroad because the eye is now back to normal from that potato. So you're absolutely right, it works. There's something that is in that potato which I will pay more attention to. But yes, it actually works and is ideal. I will not be the one to prescribe it, especially made from a hygienic and a reliable source. I won't tell someone to go and do it at home. Like when we watched the wrestling, he said, "Do not try this at home," but you know that it works. So it actually works, man.
Is it the red one or the blue one? Loma.
Sorry, the red.
The red, okay. Thank you for the lecture, ma.
Okay.
Can I continue? Can I say?
Yes, sir.
I'm very, very happy with this lecture. One thing is that there are some things I've been doing on my own personally, but especially this eyeball ruling now. The one you added for me, breathing in and closing my eyes. I was not adding them. I used to roll my eyes every now and then. I roll it front and back and all that. You know, when I wake up in the morning, before I read anything, I roll my eyes, I roll it down, roll it. But you added the same thing now. Secondly, most of the supplements you mentioned is part of my daily something like vitamin E, omega 3, zinc is my daily something. And lutein, I told something about lutein that I'm very happy about now. Actually, I've been taking lutein on my own. I just take it. Not that I'm just taking it. But last month or so, last 2 months or so, I normally go for my eye checkup in our military eye center. So I went there. They gave me. I don't use glasses. I use glasses for reading only, not for seeing. Just for reading. In 2016, they gave me reading glass, and then I came back after 2 years, check it. They say no, it has not changed. I still continue it, the same arrangement. Then this last month I went, they now said, Oga, your glass since 2016, the reading has not changed till now. And then that I do not have any problem. And then I said, there's something they're going to recommend to me, which I've been using regularly. I said, what is this? He said, if I get money, I can buy it, from my use. It was expensive. I said, what is it? He said, lutein. I kept quiet. I just laughed because I'm already a chairman in lutein. So I just said, I just looked at it and said, okay, no problem. I will try to order it and this is. So what am I saying? What I'm saying that I now found that I've been doing the right thing. So I now said, okay, this lutein, because they didn't know that what I'm taking, but they were surprised why my site is made like that, no change and everything, So, but when I mentioned lutein, and I should buy it, if I get money, I should buy it and this thing. And lutein I always have, if you know the way I buy things, I'm greedy, I buy things, sometimes it is very greedy.
Sir, I want to say thank you so much. During the last lecture, somebody even called me and said, was talking about you and saying that, the co-presenter, when he start talking, I cannot even talk again, this and that. But you know what? What you have just said today will still allow me to be, welcoming this because I just did a lecture down and I mentioned lutein and zeaxanthin. I didn't know that people have found out and they have now packaged it and kept for people to keep buying elsewhere. And that's why I say keep coming to this lecture. Sir, to God be the glory. I'm happy that, you're one of the role models in terms of how you came to the clinic, everything you have done, and you actually exemplify the fact that if you embrace what we teach, it works. Why am I saying that? You used to send to our nutritionist the food you eat every day raw and all these things, and I didn't know that your eyes have remained perfect for the past since 2016. This is almost 6 years or 5 years in one place, and it hasn't changed. And they want to sell you lutein. So take it from one of your members that, like I said, lutein, you buy it from anywhere. It's just that if it is professionally done, so I've given you the active ingredient. And I also said something. If you go to buy lutein and zeaxanthin and they say it's cheap, please know that is the label. You see, Oga just said that we can introduce you to something and it's expensive because it's not a cheap antioxidant to come across. So, sir, thank you so much for that. I'll take questions from other people.
Thank you so
God
much.
bless you. Thank you, sir. All right. So any other contributors? Does anybody have wet eye, dry eye? Let us hear about your eye because we can learn from everybody.
Sorry, but there's a question in the chat.
Okay, it says, thank you so much, Dr. Susan, for all you do. May God bless you richly. Amen. And may God bless all of you too richly. We are getting blessed together. Please. I sent an audio message about 2 weeks ago. I will appreciate if you please open and listen. Please, can you resend? I want to tell you that sometimes I get in a day, I get 500 messages. So especially if there's no number, and I'm so sorry, please forgive me. So kindly re-forward. I give you my word. I will reply this night before I sleep. That's a promise in front of my entire family here. Was I supposed to do the exercise with my pair of glasses on? Yes, you can do it with your pair of glasses or without. But what we are just telling that exercise, whereby just roll your eye up. You can be tapping if you want to. Roll your eye up, roll your eye down, roll to the side, and then just roll, roll, roll. Close your eyes. Take a deep breath in, out, open. Anything you're looking will be much clearer. You can relieve your eye pressure. All these glaucoma people, dry eye people. When I say people, like people that have dry eye, people that have glaucoma, people that have that is such a powerful eye exercise. It is equivalent to when you come to the clinic, we make you do deep breathing exercises and maybe alternate nose breathing exercises, and you can see your BP crash. It comes down visibly. It means you can relieve your body. That is what this type of lecture is all about. It doesn't mean that it's cure, but it's a relief. But long term, it will cure. So I want to say God bless all of you. Today's lecture was kind of technical, but just a reminder that we need to protect the eyes. We will all get sunglasses, change our current glasses to the one that can turn dark under the sun, because sun is damaging the instant it touches your eyes. Is the number one, apart from the one from inside the body. So your eyes is damaged from inside the body and from sunlight. So we'll get the sunlight, and then we should support ourselves with eye-friendly food and eye-friendly vitamin. Last word. Vitamin A don't go and buy this product contain vitamin A. This one happened to one of our clients. When you take too much of vitamin A, you can actually harm yourself. The vitamins that harm you in high doses are A, D, E, K, ADEK, A, D, E, and K. Vitamin like vitamin C is water-soluble vitamin, B, water-soluble. This vitamin C, if your body takes what it needs, it washes the rest away as the urine or anyhow. It's not as detrimental, but this A, especially for eye, so stick with one supplement. Don't buy multiple, like I'm using this one. You can actually, and then also, if you're using an eye supplement and then another supplement, check if the vitamin A is already complete in one or the other. So that is just a caution. I want to pray for you that God protects your health, protect your eye. Even if there's eye problem, it stops cold today and your eye begins to repair and everything is good for you. That's my prayer for you, so that you live long and enjoy the beauty of this world. So
Sorry, ma, there are some questions from YouTube. Should I read them out or?
Okay, go ahead.
Number one, what of the person that had both glaucoma and cataract surgery and is still having problems of water drainage? What can one do? Number two, what are the names?
I know that Glory is the one reading because your own is speed.com. Calm down, no, please. Let me get pen and paper and and be writing. Okay, so the person has both glaucoma
and cataract surgery and is still having problems of water drainage.
Okay.
What can she do?
Okay. What else?
What are the names of the supplements for the eyes, please?
What
Then
are the
number
names for
3.
the supplements?
Yes, ma'am, for eyes.
Okay.
Then the third person said, "Thank you, Dr. Susan. When you mean the red potatoes, is it the one that is red on the outside or that is red inside?"
Okay.
That's all, ma'am. Thank you, ma'am.
Okay, so for the red potato, if you see a potato, if you cut it, you can see the inside. When the inside has a color, a pigmentation, especially like very deep orangey or purely purple, whether it's from the inside or the outside, or the most important thing is that when you open the inside, the color must not be white. That is the potato that I am talking about that is extremely powerful for your eyes, okay? So any rich colored potato, preferably that one that looks like carrot inside or purple inside. In fact, it's so rich and good for the eye that they are using it to make eye drops, and it's working. It's working. I'm not sending you to go and do or don't do, because if you don't know how to do it, you now do more damage. But it start eating it. So that one actually work. Now, one of the things okay, I don't know, maybe I have to project again the eye supplement. There are many eye supplements, but don't buy, let's say, God forgive me, Centrum for eye. No, it's too commercialized. So just when you go to the pharmacy, they will spell out in a very big term, lutein, zeaxanthin, or you know what, Glory, we will look for a very good eye supplement, maybe like a similar one that we have in our clinic, put it here, then they can just buy it from any pharmacy near them. So we'll just give you some suggestions so that everybody can buy. But like I said, if you don't have the eye problem to that extent, the best thing for you to do is to get it from food sources, your cover, your potato, etc. Okay? For the person that is still having cataract and this and that, sometimes the problem can come from the healing process. Okay? There could be a problem from the duct drainage. So it is the reason why the theory and the eye thingy is not, there's a reason. So if you're in Abuja or Lagos, you can stop by, we can take a look at it for you. You can do this eye food and what we are talking about right now, it will help. You can actually also support it with maybe warm compress or cold compress, actually, to the eye, small. And so, but with eye, it's very tough to just tell you what to do over the phone. But all I can tell you is that it could be something called a dry eye syndrome. So dry eye syndrome is a permanent syndrome that the only thing that continue to happen is wetness of the eye. So if the syndrome is there, no matter the glaucoma or the cataract correction, it will still be tearing up and stuff. Number two, because you've had 2 surgeries, the healing process could have been a problem. Number three, maybe the duct. It just has to be, just have to revisit the doctor on it. Or maybe call me and then tell me a little bit more, and then I'll tell you what you can do as a natural remedy from home. So that's that. Okay. For the rest of us, I just want to thank you so much for spending your hour with me every Wednesday evening. Believe me, for how much that I pray for you, it cannot go to waste. But I also ask, share with at least 10 people, share with your family members what you have learned so that we can have good eyes. Yes, sir.
When you roll your eyes,
Yes.
when you roll the eyes, for those who want to roll the eyes, when you roll the eyes, you roll it too well. There's a vibration on this on your eye to know that you roll it too well. Not just rolling eyes. When you roll it too well, up and roll it down, there's a tingy some vibration in your eyes to know that you roll it well. But not that
Yes.
just make your eyes like this, like eyeing somebody. No. When you roll it, you feel it. You feel the vibration, and that's the side that you're like, and then just want to contribute. Thank you.
Okay. Thank you so much, sir, and God bless you. All right. So by God's grace, we will see next week. It will be too exciting. I know I've never done this, but I hope people will send me birthday wishes. My birthday is on Sunday. So just keep me in your prayers. Honestly, that will be more than enough. So by God's grace, I'll see you next Wednesday. So have a wonderful night and God bless you for me. Sleep well and see you soonest. All right, take care.